All right, here we go. Last dermatology lecture of the quarter. It is not summer, though. It is the fall of 2020. It is week 10. And let's talk about moles. What is a mole? Is that a mole? That's a mole, but that's not the one we're talking about. There's another mole, like a spy. Avogadro's number? Oh, dreaded general chemistry mole. No, thank goodness we're not talking about that. There's a mole. We don't call him a mole, though. In dermatology language, we call him a melanocytic nevus, or nevi for plural, nevus for singular. And let's see. Acquired means that we have acquired them after birth, quite often around after 6 months of age or so. They pop up usually fairly quickly. They are one of the most common dermatological lesions on the planet. All humans, it's incredibly rare for a human not to have a single nevus formation anywhere. So most humans have at least one. 55% of adults, in fact, have between 10 to 45 of these things that are greater than 2 millimeters or bigger. They are considered a benign tumor of the skin, and they tend to be more concentrated in areas that get exposed to sun, like your face and your shoulders and your back and such. So what are they? Who are they? Well, one theory, the leading theory, is that these are actually the precursor cells that would normally morph in to a melanocyte, and the precursors are called melanoblasts, and that's what they are. Most theories are that they are mutated melanoblasts, so one step away from a melanocyte. And they don't call them melanoblasts, they instead call them nevus cells. Nevus cells. So melanoblasts, again, are the precursors of melanocytes. Nevus cells, when they mutate, they tend to like to hang out together. They don't always, but they tend to. And this little hangout group of them, usually down by the by the epidermis dermis border, or kind of border there, they tend to form what are called nests. So mutated melanoblasts are called nevus cells. Where do you find them? They're usually clumped together in groups called nests. And these mutated melanoblasts, they go through mitosis, just like basal cells do. Basal cells split, right, and form a keratinocyte and a new basal cell. And they're ratcheted up toward the surface. Same deal here. These nevus cells split and split and split, and they get pushed up and up and up, and pretty soon they appear on the surface of your skin. And they last also about 24 days, and the top ones slough off, but other ones are constantly coming up from the bottom. Right, so that's the deal with that. They are not full-blown melanocytes. They differ in quite a few ways. They're bigger. They don't have any dendrites, or octopus arms, I like to call them. They have a lot more cytoplasm because they're bigger. And they may have coarse granules, which live in kind of hang out inside the cytosol. Embryologically speaking, they are still, they're precursors to a melanocyte. So therefore, they are neural crest cells. We'll remember from back in the embryology days. There's our friend, the melanocyte. It looks like a little octopus, right? And there's its dendrites, or its little octopus arms. What does it do? It injects all these cells with melanin. Where's the melanin come from? It produces melanin within its cytosol and injects it, and the melanin, of course, goes over these keratinocytes and forms a cap which protects them from UV radiation. I think we've kind of already said one of the great ironies here is that its own nucleus is not protected. So that's really quite strange, and it's susceptible to UV radiation damage, mutation, and malignant melanoma. There's 3 different presentations of these things. So they typically start out again in the stratum basale, and they send cells upwards just like regular keratinocytes do, but then the nest tends to work its way downward. So it does get into the dermis at varying depths, and the longer it's around, the deeper it tends to go. Therefore, moles tend to have different looks, which are directly related to how deep they live within the dermis. Okay, so there's 3 different types of them, and these types are based on their depth of the nest, or the nest location in the dermis. So when you first have these things, probably when you're 3-4 years old, or during childhood, they might pop up. They are very superficial. They're in the dermis. The nest is in the dermis, but it's superficial. And those are called junctional nevi, or type A, which are made of type A nevus cells. Maybe another 10, 20 years goes by, and that nest starts to push deeper into the dermis and changes the appearance on the surface. These are called compound nevi, or compound melanocytic nevi. And they're made of type B nevus cells, found at medium depths. And then we have the maybe 30, 40 years go by, and they get way down in the dermis, and they are called at that point type C nevus cells, and they give rise to these really warty looking things called dermal melanocytic nevi. So it typically goes through, doesn't always, I mean, you could be just one could pop up and it could be compound or dermal, but it usually doesn't happen like that. There's a really nice picture of this, and we can see this is a junctional nevus. It's right at the epidermal dermis junction here, and yeah, we can see it, and the nest would be here, but I mean, all these cells are reproducing and sending cells upward like that. And so you keep seeing, remember that every 23 days these cells die, so there's a constant stream of these going up. As the main nest gets deeper, like this is mid-dermis, these are called compound nevi, or this is a compound nevus. And then as they get really deep, when the nest gets down here in the bottom, these are called dermal nevus. And sometimes these cells don't actually make it all the way up. And by the time the ones that do make it don't have much melanin in them anymore. So you can get kind of a skin colored here. All right, here's some of these nests, how they live down in the dermis. Don't worry about that picture too much. They typically are colored. Melanin is various shades of brown or black, and again that they produce these melanoblasts are precursors, so they do produce melanin, but they don't have any tentacles. They have no dendrites to get rid of it, so it's trapped within their cells, and that's what gives them the various shades of black-brown. When they get really old, as I said, they stop producing melanin. Yet the cells still go to the top, and then here is a dermal nevus, which has no pigment color, and that's usually the sign of a mole that once was flat and blackish brown, and it started to have some height to it, still blackish brown, and then it lost its height. It doesn't always have to be like that, but that's typical. Then some people are born with these things. So about 1% of nevi actually are present at birth. And if they're present at birth, they are called congenital melanocytic nevi, or CMN. So about 1% again. These are also called birthmarks, and they're rare, one out of 100. Most of them are acquired after birth, and those are called acquired melanocytic nevi. These congenital ones, we have to talk about them because they can get crazy, crazy large. The acquired ones are usually less than 15 millimeters. These guys can be really, really big, as we'll see. This is a 19-year-old with a large congenital melanocytic nevus on her face, and they're, depending on the size, they're asymptomatic. They don't hurt, but that doesn't mean that there's not problems with these things. Right? First of all, there's a huge psychosocial issue with this. Probably one was teased when she was little, although I guess the teasing is probably not going on as much as it is when I was a kid. But I'm sure she's still been teased about that or stared at. So psychosocial issues. But the big ones can become cancerous. So we better talk about these congenital melanocytic nevi. What are they? They're birthmarks. And we'll look at how they're rated here in a minute. They're typically, they start out usually on the trunk, especially the really big ones, somewhere around the waist. Also oftentimes down in the lower back area, but they can be in the front as well. They can also occur in the extremities, and as we just saw, they can definitely occur in the face, although that's not the usual spot for them. One differential diagnosis is neurofibromatosis 1, which gives this classic port wine, or this cafe, not port wine, that's nevus flammeus. This cafe au lait spots, which look kind of the color of coffee. So those are not congenital melanocytic nevi. They're not birthmarks, but you can see how they could be confused. And neurofibromatosis 1, of course, is also has this. These aren't the problem. The problem is tumors. You can get tumors in the nerves and all sorts of trouble with that. All right, here's an important slide. I just actually made it today. Kind of rework these slides a little. So this is probably the most, there's other ways to classify these, but this is the most common way. So there's small, medium, large, and ridiculously gigantic congenital melanocytic nevi. So 15 millimeters or 1.5 centimeters, anything less than that. So that 15 centimeters is kind of or 15 millimeters is the cutoff for small ones. So anything from 2 to 14 would be considered a small congenital melanocytic nevi. Anyone from 1.5 centimeters to 19.9 centimeters is considered a medium, which is at medium risk for cancer, by the way. Anything between 20 and 50 is considered a large congenital melanocytic nevus, and anything over 50 is just really big. That's considered a giant congenital melanocytic nevus. This one's got some AKAs. These are sometimes called giant hairy nevus, or giant hairy nevi if there's more than one. Bathing trunk nevus, because they start down at where your belt line would be, down around your waist. Swimming trunk nevus, hairy birthmark, capus or cape nevus, neurocutaneous melanocytosis. They're all AKAs for a giant birthmark that has at least one diameter 50 millimeters. So how would you measure something like this? They just say find the biggest diameter you can find, and if that's over 50, you got yourself a giant hairy nevus. Okay, again, the big ones over 50 have the two most common names are giant hairy nevus and bathing trunk nevus, but they're still just giant congenital melanocytic nevi. And again, they typically start down at the waist. That's why that AKA is bathing trunk nevus, because it happens kind of down where your bathing suit, the waistband would be. All right. They also, when they get this big, it's very common for them to have associated smaller nevi, but close to them. They're called satellite nevi. When you're first born with this, they don't usually have hair, but with the passage of time, really coarse hair, almost like horse hair. If you've ever been horseback riding and petting the horse, they have that super thick hair. It's almost like that. And that starts popping up with the passage of time. They're just like a regular nevus. They're usually black to brown in color. They could be other colors, but usually black to brown. So here is definitely a giant congenital melanocytic nevi. You can see it started at the waist. They've already had a huge surgery here to remove a big piece of it that became malignant. But this is a good example of all the satellite. Look at all the satellite nevi associated with this. So this patient has to be watched probably every 6 months, I bet, by a dermatologist. That's what I would recommend. The aging effect on congenital melanocytic nevi. I kind of said this. They typically start out flat in childhood, and they get thicker and thicker and thicker and hairier. I didn't say thicker before, but they do get thicker, and they start to get lumpy, bumpy, and sometimes even verrucous looking. That's a word for warty, verrucous. So lumpy, bumpy, verrucous, cobblestone appearance sometimes is used as well. Have to be differentiated from seborrheic keratosis. If they're 8 millimeters or so, they can kind of look like seborrheic keratosis, and even melanoma in some cases. Speaking about that, what is the risk for cancer? Well, the bigger they are, the bigger the risk is a way to think of this. So larger ones can definitely become cancerous. What type of cancer? Of course, malignant melanoma, because they're made of melanoblasts, which is a precursor to melanocytes. And melanoma is a mutated melanocyte flat out, so they can morph into that direction. The smaller ones, if it's under 15 millimeters, they rarely become cancer, so you usually don't have to worry about them. So here's one, a 45-year-old male. It's 12 centimeters, so it's classified as a small one. It's been there since birth. You can tell it's been there a long time. How can you tell? Because it's not flat anymore. It's a little verrucous looking, and it's got horsehair growing out of it. That's a classic type of congenital melanocytic nevi. Right? So it's a small congenital melanocytic nevi, been there since birth. It has a small chance to becoming cancerous. I mean, if it starts changing or morphing, then you worry about that. But differential diagnosis is seborrheic keratosis. Usually doesn't have hair, though. Seborrheic keratosis, malignant melanoma, again, usually doesn't have hair like this. So now we knew the history, but what if you didn't know the history? Because we know this has been there since birth. So if you didn't, then you don't know if this is you would have to guess it's probably acquired. And if it's an acquired lesion, then it's either a dermal or a compound. Probably more, if I had to pick one, I'd say a compound, because I'd pick dermal nevi, because dermal nevi are lumpy, bumpy, and warty looking. All right. And if this came on really suddenly, though, then it breaks the ABC rules, and it should be referred out. Medium-sized nevi between 1.5 centimeters and 19.9 centimeters. They carry a kind of a medium risk for cancer. How to treat these or how to manage these is very controversial. Most authors agree that they should be monitored very closely, 6 months or at least every 12 months. Some authors recommend taking them out, not even messing with them. Some authors say biopsy them and see how deep the nest cells go, and if the nest is way down in the deep dermis, the whole thing should be removed. Okay, here's another. This is a 4 centimeter lesion. It's been there since birth. What do you think of that? Well, it's a medium-sized congenital melanocytic nevus, and yeah. If we know it's been there since birth and it really hasn't changed, I mean, you don't have to send them to the dermatologist now. If you want to be super safe and say, you know what, you ask him, do you see a dermatologist? If it's a medium-sized one, remember, some dermatologists recommend removing it. Others say just kind of observe it. So if they haven't seen a dermatologist in a year, or, oh, it's been 10 years since I seen a dermatologist, then you better write in your notes that you referred him to a dermatologist. Here's an 18 centimeter lesion in the groin of this 32-year-old. He's had it since birth. What do you think of that? Well, it's still medium, right? It's getting close to large, but not quite. Should monitor it and keep a close eye on it. Should be seen by a dermatologist at least every year, I would say. The large ones, so when they get large, we said they are between 20 and 50 centimeters, or 49.9 centimeters. Or another definition, if the lesion takes up more than 5% of the body surface, that's pretty hard to figure that out. So we get the measuring tape out and measure it. These are not good. They have a significant chance to turn into the deadly malignant melanoma. Usually it happens really quick, though. About 50% of these are going to happen before the age of 5 if they turn into melanoma. So these need to be removed as soon as possible. The lifetime risk for developing, or incidence for developing cancer, is about 5% in these people. All right, here's another one that's really, really horsehair. That's a giant one, obviously. Okay, let's go back to, that's enough about birthmarks. Let's go back to acquired melanocytic nevi. They typically appear in childhood, we said, and they reach a peak by about the 3rd decade of life. Puberty is when they pop up the most. So 10, 11, 12, 13, 14 is when most humans start puberty. And so they might have moles popping up. And of course that's going to scare mom and dad. And look, oh my God, I got a mole. I never had that before. It's likely to be just a mole. But I mean, if it breaks the ABCs and is popped up quickly, even though it's probably a mole, you need to protect that expensive license of yours, refer them to a dermatologist. After the age of 50 and they pop up, that is not normal. They should see a dermatologist for that. Always suspicious of cancer. Of course, over the age of 50, you have lentigo lesions, and seborrheic keratosis can pop up. I just turned 60, and I have these seborrheic keratotic lesions popped up, and they came on so fast. I'm like, oh my gosh! And even though I teach this stuff, it still alarmed me enough to go to a dermatologist to say, yep, seborrheic keratosis. But you gotta, if you have these things when you get old, you have to establish a relationship with a dermatologist, because melanoma will kill you fast if you catch it easy. It's very, very treatable. But if you let it go, Bob Marley story, which we'll talk about when the time comes. All right, Caucasians are more susceptible. Some old wives' tales about these things. You should never pluck a hair from a mole. It's going to turn cancerous. Absolutely not true. You should never pick at it. I mean, it's probably not good to pick at it anyway. It could get infected, but that's not going to increase the risk of cancer. If it gets ripped off accidentally, if it gets cut off, if you pick it off, that has nothing to do with the chances of it becoming cancerous, according to the research. The risk of melanocytic nevi, acquired melanocytic nevi, are usually under 15 millimeters. It's quite low. They usually don't become cancerous. There is some caveat to that. If you have a whole bunch of these moles all over your body, the more moles you have, the more chances that one of them could become cancerous. So there's a directly proportional relationship between the number of acquired melanocytic nevi on your body and the chances of getting cancer. Yeah, they usually don't change shape once other than what we talked about, they do go through some changes. If they change shape rapidly, of course, or change color rapidly, those are always signs of cancer. Now this one looks just really scary. So here's an 8 millimeter lesion on somebody who came in. Really nice, high quality photo. They obviously have some moles going on here. But that one is variegated, and it's kind of irregular borders, and it sure looks like malignant melanoma. Melanoma might have some darker darks and some lighter lights and some more coarsely variegated, but that did turn out to be a mole, acquired a junctional melanocytic nevi. It had a little surface to it, but yeah, so they can be confusing. When in doubt, send it out. Variegated, yeah, they can be variegated. Yeah, we just saw they can be variegated right there. So various shades of brown. If it is variegated and it's non-cancerous, it will be just like this, a light variegation. There's not striking difference. It's not black here and super light brown and absent here. It's just kind of a faint variegation to it. But don't always count on that. Early melanomas really look exactly like a mole. They can look solid, have a solid color to them, have a normal border, not variegated yet. But once it starts going, it'll usually starts getting that variegated look. We already said the adolescent growth spurt, very common for them to pop up in that second decade of life. Scares the patient, scares the person. Go see the dermatologist to get a peace of mind. There's the subdivisions we've talked about already, junctional, compounded dermi. They do tend to grow deeper into the dermis with the passage of time. Let's look at junctional. Let's go through that classification system. So junctional nevi, that's usually the first one that pops up in the child. It is located at the dermal epidermal border. That's why it gets the word junctional. They're medium to dark brown in color. They're flat. They're not usually variegated. They're usually a solid color, but if they are variegated, it's a very light variegation. They're not verrucous. They're not warty at all. There's a little 3 millimeter lesion. It's slightly variegated, but not crazy. It looks pretty symmetrical. I mean, that's a classic run-of-the-mill junctional nevus. They don't have hair. It takes time for them to develop hair usually. And the progression in melanoma is really, really rare. Usually don't have to worry about these things. But with the passage of time, they could move into the next stage, the compound nevi stage, and then they're going to become more elevated. They might start getting some hair coming out of them. Variegation could change a little bit. Okay, what about this one? It's 4 millimeters. It is uniformly variegated. That's a junctional nevus. Now that one's a little more not so good looking, right? It's still not super darkly. I mean, it's not black here and brown here. It looks like a dark brown and brown. But that's, I mean, if that's 9 millimeters, it's over 5 millimeters. That breaks the ABC rules. You would send that one out, and they might say, oh, that's been there all for many, many years. Or they say, hey, I never noticed that. Might be working on their back and that pops up. And they go, oh, I never noticed that before. That needs to be looked at by a dermatologist because it breaks the ABCs. This one turned out to be seborrheic keratosis, which is the great imitator. We've talked about that. Could have just as easily been melanoma, though. Melanoma can look like that. All right, there's the ABCs. We've went over those, haven't we? Asymmetric borders, color, diameter, evolving. Yeah, so if it breaks any of those rules. Okay, so 10 years goes by, 15 years go by, and maybe it starts getting raised up a little bit. Maybe some hair starts popping out of it. So these compound nevi is the second stage. That means that nest has moved down into the mid-dermal region. And these tend to be more elevated than a junctional nevi. They're still light brown. And yeah, they have some hair growth. So here's one that's raised up quite a bit. It's kind of hard to see on this image. That's junctional nevus. Okay. There's another one. 5 millimeters. This is a compound nevus. Another compound nevus. Kind of hard to tell that these are raised. That's the key there. May or may not have hair coming out of them. Oops. Oh man, you should. I'm going to train you to just think evil thoughts when you see something like that. So it's 9 millimeters. That breaks the rule. It breaks all sorts of the ABC rules, right? But look at the different variations. So it's pretty dark right here. It's really light here. It's different shades of brown here. There's some spots where it has no color. This is classic of melanoma. So that is a melanoma lesion. That would be very unusual to be anything else. Seborrheic keratosis can imitate it, but that, in this case, it did turn out to be classic malignant melanoma. And the last stage, maybe 30, 40 years goes by, the nevus cells and the nest has moved way down into the deep dermis. And yeah, these guys are really warty looking. We'll look at a bunch of pictures of these things. They're verrucous. Another AK for verrucous is papillomatous, and verrucous both mean warty in appearance. Make sure you know those. I assume you're going to know those for the test. Yeah, and they can appear in the face, and let's look at some of them. So, dermal nevus, definitely warty, really raised up. Tend to be lighter shades of brown. And remember the colors, the pigments. When the cells get so old, they stop making pigments, so they're not usually as pigmented as they were before. They might even be complete skin color. They can have a lot of hair coming out of them at this point, but not all of them do. And some of them get pretty darn large. So there's another really big one there, 7 millimeters. Definitely a dermal nevus. Now, when you start seeing, it looks that's elevated, it looks like a dermal nevus, but we got telangiectasia. That's a sign of fast cell growth. So you have to be really, really careful with that. Basal cell carcinoma can look similar to that. Well, we've talked about that, right? It's even got a little ulcer right there. That was basal cell carcinoma. So that should have been furred out. How about this one? Definitely kind of warty looking, hair coming out of it. And that's just a dermal nevus there. Run of the mill. Now they're kind of a weird, this is an unusual one, but again, it's warty looking. It's a dermal nevus. How about that one? Well, it looks innocent until you look really close and you see the telangiectasia inside of it. So that makes you a little bit nervous. That one's got to be referred out, right? Send that out for biopsy. It did turn out to be a dermal nevus, but the telangiectasia can mean fast growth, just like this one. Looks like a run-of-the-mill mole. But because of the big vessels here, you got to think it's probably basal cell carcinoma. It did turn out to be a dermal nevus, but you just can't tell. You have to it had to be biopsy to tell what it was. It could have been basal cell carcinoma. Just to recap, we've already went over these stages. I could probably take this one out. It's not quite as good as the other one. It just shows that the junctional nevi are flat or maybe slightly elevated, and they progress to a more elevated structure, and then they progress to an even more elevated structure that is kind of warty looking. How about this one? Very slightly raised, 4 millimeters in size. That's classic, right? Junctional nevi. It could be a compound. A little too dark to be junctional was the thought here. Usually for our purposes, if they're raised up at all, I'm going to call them compound nevus, even though some junctional nevi can be raised a little bit. Right, there's one right on the eyelid there, right? It's dark, it's got hair coming out of it, so that's considered, because it's elevated, that's a compound nevus as well. What about management for these things? Any pigmented lesion malignant melanoma should be ruled out if it breaks the ABC rules. And they'll do a biopsy first to see if they need to cut it all the way out. All right, it's been a great quarter. Sorry I couldn't be there in person lecturing to you. Like the days of old, hopefully, well, actually, I won't see you guys anymore, right? Your 7th quarter. So next time I'll see you, you'll be walking down the podium. All right, take care.